Example question. Which client is at the highest risk of developing iron deficiency anemia? A middle-aged client diagnosed with gastric ulcer. A middle-aged client who avoids meat products. An older adult client who received chemotherapy for 6 months. An adult client who lost 30 pounds over the last 2 months. The knowledge from the textbook: the body's iron requirement is 25 milligrams daily and can be ingested from food or supplements. Only 1 to 2 mg of iron is absorbed from diet. The rest of the iron comes from continued recycling of iron from RBCs. As part of normal iron metabolism, iron is recycled after macrophages in the liver and spleen phagocytizes old and damaged RBCs. After dietary iron is absorbed in the duodenum and proximal jejunum, transferrin transports it through the plasma. Transferrin is made in the liver. The amount of iron that is bound to transferrin is a reliable indicator of the iron supply for developing RBCs. About 2/3 of total body iron is bound to heme in RBCs, hemoglobin, and muscle cells, myoglobin. The other 1/3 of iron is stored as ferritin and hemosiderin, degraded form of ferritin, in the bone marrow, spleen, liver, and macrophages. When iron stores are not replaced, hemoglobin production is reduced. There is very little iron loss except from blood loss. The body loses about 3% daily in urine, sweat, bile, and epithelial cells in the gastrointestinal (GI) tract. The correct answer is a middle-aged client diagnosed with gastric ulcer. Gastric ulcers can cause chronic blood loss due to erosion of the stomach lining, leading to iron deficiency anemia, IDA, over time. The stomach is a key site for iron absorption, as ferrous iron. Slow, hidden blood loss is common in gastric ulcers, which gradually depletes iron stores. So, this client has both impaired absorption and ongoing blood loss, making him the highest risk for IDA. A middle-aged client who avoids meat products is not correct. While a vegetarian/vegan diet can increase the risk of iron deficiency due to lack of heme iron, it does not pose as high a risk as chronic blood loss. The client can still absorb non-heme iron from plant sources: beans, spinach, fortified cereals, which can compensate with vitamin C to enhance absorption. IDA develops more slowly with dietary deficiency alone compared to blood loss. An older adult client who received chemotherapy for 6 months is not correct. Chemotherapy can cause anemia, but it is more likely to be aplastic anemia due to bone marrow suppression or anemia of chronic disease, ACD, rather than iron deficiency anemia. Chemotherapy does not typically cause blood loss or iron malabsorption. An adult client who lost 30 pounds over the last 2 months is not correct. Rapid weight loss can be due to malnutrition, cancer, or malabsorption disorders, but it does not directly cause iron deficiency anemia. If the weight loss is due to GI malignancy or bleeding, then IDA could develop, but the question does not specify this.